Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Get health information and tips for optimal well-being.
How to prevent it, detect or treat it.
This is Smooth Health on the Drive. Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Of course, you're welcome to Smooth Health on the Drive, inside of Smooth 98.1. Love music, love life. My name is Judith TV. Good afternoon to you and welcome to the show. Smooth Health on the Drive is brought to you courtesy Evercare Hospital. And today on the show, I must first announce that we are gifting, our first 3 callers today at 10,000 naira worth of voucher. Now, that voucher is going to go towards your fee, your first consultancy fee at Evercare Hospital. So you get a chance to get a world-class healthcare at your fingertips right here inside of the heart of Lagos, Lekki to be precise. Oh, thanks to Evercare Hospital. All right. And remember that the show is brought to you by Evercare Hospital. So today we are going to have a very interesting conversation. And this time we'll take a look at neonatal care. This time, neonatal jaundice. And to do that with me, I have Dr. Ebere Agwu. She's a consultant pediatrician and a clinical pharmacologist with Evercare Hospital. She has expertise in pediatric and neonatal emergency, resuscitation and critical care, and pediatric nutrition, Boston University 2017. Her thesis is titled Assessment of Stroke Risk by Determining Cerebral Blood Flow Velocities and Other Selected Factors in Children with Sickle Cell Anemia in Lagos. So I tell you for free, you are in the right hands to ask all your questions when it comes to neonatal jaundice. In addition, she also has managerial and leadership skill in health, Washington University 2017, as well as clinical, entrepreneurial, and patient-centered skills from the University of Bocconi. Milano 2017. Now, Dr. Agwu has a certification in basic life support, BLS, and pediatric advanced life support, PALS, by the American Heart Association. She has gained wealth of knowledge and experience in the management of different pathologies in preterm babies and children, having practiced in different government and non-governmental hospitals in Nigeria with over 15 years of experience. All right. So today, get all your questions ready for Doctor. So to call us up here in the studio and also stand a chance to win our vouchers, our telephone numbers is 014489981. Again, 014489981. You can also send me a WhatsApp message with all of your questions on 0809-444-0981. Again, 0809-444-0981. Dr. Ebere, you're welcome to the show.
Thank you very much, Judith.
Thank you. Thank you for coming on board today. But so let's get started with the basics, all right? What does a pediatrician do, and how is it the pediatric care approach is like at the Evercare Hospital?
Thank you very much, Judith. So, pediatrician is just simply a medical doctor who takes care of the mental, physical, the social, the emotional, the behavioral care of children. Not necessarily children who are sick, but children who are also healthy, who take a lot care of them, taking into cognizance their well-being and their developmental milestones. Now, in Evercare Hospital, world-class hospital with 165-bedded hospital, we have in neonatal intensive care where we have lots of incubators, transport incubators. We have our ventilators, CPAP machines that we use to take care of premature babies.
Nice.
We'll take care of babies are critically ill, less than 30 days old. We also have phototherapies and that we use to take care of people that present with jaundice. We have our pediatric intensive care unit where we take care of children that are from 1 month to 16 years old. These children are those that are critically ill, that need one-on-one approach or probably need a life support. They stay there, and we also have to take care of them. We have our inpatient ward admission with beautiful ward class situated in the hospital.
Nice.
We also have our outpatient clinic, our specialized outpatient clinic, where we also have our visiting cardiologists, neurologists, endocrinologists that come attend to children with different various needs. We have also we also do a transport system in which we pick up preterm babies or babies that are critically ill from different hospitals to our hospitals in safe care. Nice. And not to forget that we also have a telemedicine in which you can stay in your cozy house and try to consult even from your bed, from your kitchen, and discuss and have a consultation with your pediatrician. And, we just sort out whatever issues you have with health, whether it's mental, whether it's emotion, whether it's physical. Thank you very much.
Oh, that's amazing. So what are some of the health challenges that occur in babies after birth?
Oh, thank you very much. In newborn babies after deliveries, they present with a whole lot of different health issues, but I'm going to just discuss the common ones. So they can, have their sugar low. They can have bleeding because they had lack vitamin K. They can present with jaundice, which is very, very important and one of the most commonest things that make mothers who have delivered to stay back in the hospital. The children may not care, cry, and we may have to move them to our special baby unit, the intensive care unit. These children may literally also have convulsion. They may have their blood low. So we practically have these children presenting in newborn with different problems, and we anticipate, watch, and take care of them. Thank you.
Oh, that's great. You can call us up if you have any questions for our doctor today. Call us up on 014489981. Again, 014489981. That's our telephone number for you to call us up. You can also send us a WhatsApp message to 0809-444-0981. Again, 0809-444-0981. So, neonatal jaundice. And it's recognized by the World Health Organization as one of the 9 danger signs of neonatal illness. But what is neonatal jaundice, and how can it be identified in newborns?
Okay, thank you. Neonatal jaundice simply just means yellowness of the skin. It's just a sign, a symptom that is just seen by anybody. So this neonatal jaundice is usually common in newborn babies because it can occur in nearly almost every child that is born may have neonatal jaundice, the yellowness of the skin. So the jaundice arises in newborn because when they are inside the womb, they need extra blood, red blood cells, to meet up with the oxygen needs of the while inside the womb to be able to survive. So as soon as they are born, these red cells are useless. They don't need them. They break down. And literally once they break down to what we call bilirubin, which is what we test to see the level of the jaundice. So bilirubin is like the end of the breakdown of the red blood cell, which manifests as jaundice and yellowness of the skin, which we visually see with our eyes. So these red blood cell can even get worse in mothers who don't initiate breastfeeding on time. So once you have a delivery and the breast milk is not initiated on time, the child is likely to lose weight. The child is likely to have jaundice because he's also going to get dehydrated. And also because there's also an enzyme in the liver we call uridine diglucuronidase transferase, UGT, which is found in the liver in newborn babies, is literally like 1% of the adults until they are 3 months old. So that enzyme UGT literally helps to help to clear the bilirubin from the system, where the liver will have to extract and move to the stool. So if it moves to the stool, that's the poo, if that enzyme is absent, what it means is that the child is going to have lots of bilirubin not being cleared from the system, or excess is being produced. And if the enzyme is absent, the child is going to have increased yellowness in the body system. And these jaundice can literally be observed by everybody: the health workers, the parents, the people surrounding or taking care of the child. By visually looking at the eyes, you'll see the yellowness of the eye. You can blanch the nose or press the nose, and once you press it and apply some form of pressure and release your hands, you will see a yellowness appearing there. It can actually extend from the face to the neck to the palms, which you don't want. So as soon as you notice jaundice in your child, you need to immediately call your doctor.
I'm going to stray away from questions. I'm really curious. I haven't had kids yet, but when you say initiate breastfeeding to avoid jaundice, what about mothers who cannot initiate breastfeeding at first?
So we have mothers who are not able to initiate breastfeeding, mothers who have passed through cesarean section, mothers and babies who maybe have lost their mothers. So what we literally do is that we start formula milk, but it's not an alternative for the breast milk. Breast milk is always the best because the breast milk contains a laxative that we produce within the first few hours of birth, which helps the baby to poo. And that first poo is what we call meconium in the first 2 days. And that meconium literally contains 450 grams of bilirubin. Is a lot that you need that laxative to actually push out that meconium, which is black in the baby. So if the breast milk is not available, we don't have any choice but to start. But you also need to make sure this child is feeding a whole lot well, even if you're using the formula milk. And if you're using that, make sure the child is passing lots of urine. How do you know that? You make sure you are changing at least 6 diapers in a day. Make sure the baby is happy after feeding.
Wow.
And that you're able to know. Don't wait for the child to get hungry or cry or give you cue.
Wow.
That you know that the baby is actually trying to feed very well.
Nice. At the same time, very expensive. Call us up on 014489981. Again, 014489981 with your questions. I missed 2 calls here because we're so engrossed in our conversation. But you can call us up now and I'm ready to take your call on 014489981. This is Smooth Health on the Drive right here with Dr. Ebere Agwu, and it's proudly sponsored by Evercare Hospital, okay? And we're talking about Neo-natal Jaundice. You can send us your questions to 0809-444-0981. Again, 0809-444-0981. Call us up with your questions on 014489981. We're going on a short break. When we come back on the other side, I'll take your calls.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Aha. 97.
Yeah. 1, 2, 3, 4.
The Smooth Drive Home.
Come on.
Right here on your dial. 98.1.
I love my radio. My radio is my all-day companion.
Vex's rhythm, making you move.
It's all about your big songs.
The right kind of music. And of course,
It's all about your fresh news and information.
All the information I can get, all the news I can get.
from the house to the car to meetings.
And it's all about the great ingredients you need for your journey home.
Lots of horrendous traffic stress.
Pumping loud, pumping loud.
The Smooth Drive Home. Right here every weekday from 4 p.m.
I just want to listen all day long.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned. This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Absolutely. You're tuned into Smooth, the 98.1. Love music, love life. It is Smooth Health on the Drive, powered by Evercare Hospital. And their job is to their mission is to transform healthcare in Nigeria, and are doing so with one show at a time. We're talking about Neo-natal Jaundice, and my guest today is Dr. Ebere Agwu. She joins me live here inside the studio. And I have a call here. Let's see who that is. Good evening.
Hello, good evening.
Good evening. Your name, where are you calling me from?
My name is Joy Onuku. I'm calling from Iju.
Okay. Joy, go ahead with your question, please. And congratulations, you've won yourself our first voucher for today worth 10,000 naira.
Oh, thank you.
You're welcome.
Good evening, Dr. Ebere.
Good evening, Joy. How are you doing today?
I'm fine, and you?
I'm good.
Please, my question is concerning the jaundice. How do you know when it is safe? Because sometimes they'll tell you that, the level of the jaundice is low, so the baby may be discharged. And sometimes you hear it cause maybe cerebral palsy and all that.
Okay, thank you very much.
Thank
Joy.
you so much for your call there, Joy. And
Thank you.
yeah, and also just listen closely to the end of the show so that I can get our WhatsApp number to send your details to.
Okay.
Thank you. You can call us up on 014489981. Again, 014489981 with your question, Doctor.
All right, thank you very much, Joy, for that interesting question. Yes, sometimes when the baby comes to the hospital to come and see us, we'll tell you that the jaundice level is low. So how do you know when it's not safe? So when the jaundice starts, it literally starts from the face and it progresses to the neck, then to the body, to the hands, to the leg. So when it's on the face, it's still very safe. Then you also need to look out for some signs that, this jaundice is actually, by the time it's getting to the body, this jaundice is actually getting really severe. The child may continue to sleep. You see the child is sleeping more often than he should sleep. The child may start crying unnecessarily that you can't be able to console the child. The child may even have convulsion. You don't want that child to have convulsion, actually. The child may have convulsion. The child may stop sucking on the breast or stop feeding. By the time the child has jaundice and is not feeding and is not sucking on the breast, is a very serious jaundice. By the time the child is moving the neck, arching the back, and raising the legs up, you need to carry that child to start coming to hospital. Now, there are different types of jaundice, and the ones that are very severe are the ones that cause cerebral palsy. Simply means imbecile. So sometimes, which is why I am here today, the clear message is there are different types of jaundice. Unconjugated jaundice and conjugated jaundice. So unconjugated jaundice are the jaundice that just are freely moving in the blood that gets to the brain and gets to the basal ganglia on the brain, staying there and damage the brain, which we eventually make this child to have cerebral palsy. And we don't want any child. No child should have cerebral palsy. No child should have their brain damaged because of jaundice that was not seen. So when you see that, you carry your child and come to hospital or consult the doctor. When we do the test, we have a graph, Botany chart, which we use to check if your child doesn't need treatment. We will tell you it's safe, and by the time we get to a certain age, by the time your child is getting to like 10 days, 14 days, you would have literally have told you that, look, this jaundice is safe, and your child will not have a jaundice that will damage the brain. Thank you.
That's
I hope I answered your question.
Very in-depth, and really, it just literally means that, newborn babies sleep a lot. So when you mean they're sleeping too much, it's like, listen, it is so hard. You can call us up on 014489981. Again, 014489981 with your question. Send us a WhatsApp message to 0809-444-0981. Again, 0809-444-0981. Now, still on neo-jaundice, it has been described as one of the most common reasons for clinical visits for newborns in the first 30 days of their lives. Now, what are some of the causes of neonatal jaundice, and what precautions should, pregnant mothers have? But before we answer that, let's take the calls here. Hello? 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 I lost you there. Call me back on 014489981. Hello? Hello? Yes.
Hello.
I can hear you loud and clear.
Good evening.
Good evening. Your name and where are you calling me from?
My name is Bolaji.
Bolaji, where are you calling me from, please?
I'm calling for Papa.
All right, Bolaji, you are a second winner for today. You've won yourself 10,000 naira worth of voucher courtesy Evercare Hospital. Go ahead with your thoughts, with your questions today for our doctor.
Thank you. Yeah, please, the question I want to ask is that what are the precautions as a husband and a wife pregnant that to be taken in order not to have jaundice?
That's very good. Putting the father as well into view there. Thank you so much for a question, Bolaji. Yeah, you can go ahead. You can still send in your questions as well on 014489981. Again, 014489981. I guess Bolaji question ties with our question. Besides just, what should pregnant women be aware of? What should fathers also be aware of as well?
Thank you, Mr. Bolaji. I hope your day is going well. Thank you so much for that question. So, husband and wife, before they get married, should try to go and check their blood group. Because one of the commonest cause of jaundice in Nigeria is ABO incompatibility. So once the mother is O and the father is anything but O, the likelihood of more than 80% of children of taking their father's blood group is very high. So literally most children take their father's blood group. So if the mother is O and the father is AB, O does not have A antigen and B antigen. So while the child is in the womb, literally carrying the father's blood group, whether it's A antigen or B antigen, what will happen is that during that place, there's going to be something we call antibodies, allo antibodies. The red antigens are being attacked. So when the child is born, he, in addition to going to have jaundice, that child is more likely to have increased jaundice and it needs to be watched out. Now, it's not a bad thing, but it's something that when the mother is coming for antenatal, blood groups are checked. When the pediatrician is taking the delivery, the child's blood group is checked. So if we see there's any form of incompatibility, that child is kept on our watch. So it's a child that will have to keep regular check of jaundice to know when it will require treatment, and that will be commenced immediately.
I'm just hearing ching, 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 money. Hello? Hello?
Hello.
Hello, good evening.
Good evening.
Good evening. Your name, where are you calling me from, please?
It's Samuel Okonkwo from Lagos.
Samuel Okonkwo from Lagos.
Yes.
Samuel, you're a final winner today. Thank you so much for calling. What's your question for our doctor?
Please, I'm asking...
You're speaking pretty low. I need you to come close to your phone.
Okay, I'm asking that what are the type of food we give to babies for brain development? For brain development? Yes.
The kind of food to give to babies for brain development?
Yes.
All right, thank you, Bolaji, Dr. Samuel, for your call there. Let's see who this is. Hello?
Hello?
Good evening.
Good evening.
Yes, your name and where are you calling me from?
Okay, my name is Amuche. I'm calling from Ikoyi.
Amuche from Ikoyi. Amuche, go ahead with your question.
So my question to you, Dr. Ebere, is typically how long would a treatment of jaundice last for an newborn baby?
Okay.
Yeah, that's a good question. Thank you so much for that, Dr. Amuche. I said Dr. Amuche. Amuche from Ikoyi. Call us up on 014489981. Again, 014489981. I have a message here from Charles Chidoze, and it goes, 6 diapers a day? That's why single guys like us invest in more contraceptions. It's cheaper. Same thing I said. Let's see who this is. Hello? Hello?
Hello?
Hello, good evening.
Good evening.
Your name, where are you calling me from?
My name is Toby. I'm calling from Gerald.
Tommy from Gerald. Tommy, are you there?
Yes, I'm here.
Yeah, go ahead, please.
Sorry, good evening, doctor.
Yes.
Good evening, how are you doing?
Very well, thank you. So I just want to find out something. I have a baby who has cancer. I was wondering.
I don't know what you are close to, but the noise in the background is making we can't hear you clearly. Maybe you might want to move away from where you are.
Okay, let me try and change my position.
Okay.
Let me go back. Just a minute, please. I had a baby like 2 years ago. He had a jaundice. And so he's been having rashes and all the rest of it.
He's been having rashes?
Yeah. So someone said it's because he had jaundice in the past that's kind of related. So that's what I want to find out. Is it true?
All right. Thank you so much, Tommy. We're going to get to your question really soon. Hello?
Yes, hello?
Good evening. Can you turn down the volume of your radio set?
Okay.
Yes.
Yes, this is David.
David.
Calling from Sulu at the moment.
David, go ahead with your questions.
I want to quickly add something. It's not like a question, but I normally give my wife unripe pepper water.
Unripe pepper water. Unripe pepper water.
Pepper water, yes.
Okay.
By the time she gets to like 4 months of her pregnancy, or 5 months, I just get the unripe pepper myself, prepare it and wash it and soak it. So I start to give her. I give her for like a week or two. I don't know if that has helped in avoiding jaundice, but none of my children had that at all. And most of the times when I go to the hospital, I see children being delayed for that stuff and everything like that. But I stumbled upon it online and I started making use of it. And
all right, maybe doctor going to prove whether that is correct or not. But thank you so much for your call there,
that's more like
David.
My question,
yeah, but I think you guys should take the doctor's advice and not do things home remedies. Hello, good evening.
Good evening. My name is Ugochi.
Ugochi, hi Ugochi. Go ahead with your question, please.
I'm calling from Ikeja.
Wonderful, Ugochi. Your question for our doctor.
All right, ma'am. It's not really a question, but it's just like a contribution.
Okay.
Because in my area, a lot of children do lose their life due to these jaundice of eating. And most times it's always because the parents are not really like in the known of what jaundice is or the cause of jaundice. But in most of our hospitals, they don't really talk about jaundice. We go to antenatal, they take care of the woman gave birth, they check the baby, they say the baby is okay, you can go home. But after some few days, you discover that the baby has like the hairs on the forehead has removed. The grandparents will now come out and say, this is jaundice. They start calling it one kind of name or the others. You will still take the baby back to the hospital. They will check the baby and still say the baby is okay. But after some few days, you discover that the baby just died.
What? And this is happening in your neighborhood?
Yes, now, most times, even the last time I traveled home, I was seeing parents putting a lot of things on the child's forehead that they mix something that this thing will help to reduce the jaundice. Early in the morning, they carry the child outside, that the child needs to take the first sun of the day, that it will help to remove this thing. There's something they normally call it in my language.
Okay, where's this place at?
Like now, as I'm talking to you.
Your neighborhood where this is happening, is it at Ikeja or out of Lagos?
No, it's out of Lagos.
Okay. All right. Thank you so much, Ugochi, for your call. I appreciate you there. That's the last call we can take. We're pretty much out of time. But, Doctor, you have a lot of questions in front of you. Go ahead, please.
Thank you very much. Thank you very much, everyone. Thank you, Amuche. Start with you. How long does the jaundice treatment last? Typically, the jaundice treatment depends on individual. It depends on the cause. It depends on the level of the jaundice. So when we have a child that has jaundice, if is a normal jaundice that requires no treatment, we'll monitor that child and closely, and eventually we discharge the child from the clinic. Now, if the child requires treatment, and there are just 2 treatments for jaundice, is either you're going on lights, a blue light, phototherapy, or we're going to have to exchange your blood if it's severe. So if a child requires a treatment of phototherapy and the cause of that jaundice is not so severe, like it's not like things that cause prolonged jaundice, what will happen is that literally it takes about 3 to 4 days, depending on the wavelength, depending on the type of phototherapy you have. If you have a normal phototherapy, it may take not longer. If you have LED phototherapy, which we also have in Evercare, is going to take a shorter while. Within 2 days, you're out of the lights However, even when we get you out of the light, there's something we call rebound tenderness that will likely occur following the jaundice. So once that rebound occurs, like the jaundice level increases, what will happen is that we will check the level, but it's not going to get to the level that we will have to institute another treatment for you. So within 2 weeks, your jaundice should have cleared. However, you have those that have breast milk jaundice. So there are women that is rare, but it happens, that give breast milk. And the breast milk has an enzyme in it that is used to break an acid in the blood. So if a child is prone to having jaundice from the breast milk, they usually have their jaundice up to 3 months. But those kind of jaundice will not damage the brain. We just monitor closely, do phototherapy, go off breast milk, start the child on formula milk. Once it's confirmed, then we restart the breast milk again and monitor the child. So give and take. By 2 weeks of age, the jaundice should have cleared in most children.
What about Tommy's question of observation? Was it Tommy or David that observed that when he soaks pawpaw into water, unripe pawpaw, and then gives his wife between 4 to 6 months of pregnancy?
Okay, Toby, thank you very much. It's a very interesting question because it's not only giving the pawpaw water during pregnancy. Even children that have jaundice, a lot of grannies still give them pawpaw water. Is one of those traditional things that have no evidence. You give the pawpaw water is going to resolve the jaundice. Pawpaw water does not resolve the jaundice. It is very nutritious. Your wife is actually enjoying herself, but it's not the pawpaw water that does that. So probably you may have been one of those people that are lucky. Your child and you and your wife have the same blood group, so you don't have any ABU compatibility. You have your child does not have infection that will be prone to having jaundice. You don't have erectus incompatibility. Then you are one of those people that they have the jaundice but is mild. And if your children are actually dark, the jaundice will be there, but you may not really visualize it because they are dark. So it's very hard to see in children that are very dark. So they may have had that physiologic jaundice or normal jaundice, which will eventually clear with or without treatment and not damaging the child's brain. Thank you, Tommy, for that question.
And then lastly, I'm sure we're missing a question here, but Ugochi's was really heartbreaking. What do you say to that?
Ugochi is, thank you very much. This is one of the reasons why we are creating an awareness campaign. Evercare will soon bring up their own awareness campaign on jaundice. We're going to try to help some health centers so that teach them about jaundice, so that when they present with this jaundice, this usual thing of actually putting something on the head is because of the anterior fontanelle that they put it there. They want it to close. And if a child has anterior fontanelle that you're putting something on the head, you want it to close, and it closes before 1 year or 18 months, that child literally is going to be a dullard. So it's like that child in 3 years, they say you 1 + 1 is answering you 5. 2 × 2 is saying 6. It's not because of the child is not intelligent. It's just because of some form of mistakes that may have happened when the child was young and caused by ignorance. So we are creating a lot of awareness, trying to reach a lot of health centers and small hospitals. When they see a child that the jaundice is up from the face, is getting to the body. By the time that jaundice is getting to the leg, you need to bring in that child for immediate treatment of phototherapy or exchange blood transfusion, depending on the level, to save that child's life, to make sure that child is not prone to cerebral palsy or become imbecile in future.
And lastly, Bolaji's question on food to eat to develop the child's brain.
Oh, okay. Thank you very much, Bolaji. So it depends on what age we're talking about. We're talking about newborn here. So the best food for the newborn is exclusive breast milk. It has a lot of things that the formula milk does not have. So we're talking about newborn. So you need to make sure your wife eats well. Give your wife good, nutritious food. Eat amala, eat eba, eat vegetable soup, eat egusi, eat rice. Just make sure she eats all the necessary good food, and trust me, that's whatever you give your wife, your child will get. So if you want your child to get a good food, just make sure you take care of your wife. Like, make sure you provide every good food that your wife needs. So you're going to have a good quantity, quality, balanced food, which will contain the carbohydrates, a protein, a vitamin, and multi-nutrients in it. Thank you very much.
Oh, that's really wonderful. Thank you so much, Doctor. We're out of time already. We've gone past our time. And of course, when it comes to Smooth FM listeners, they always, hijack the show and take it besides it's for them. But before you go, Doctor, tell us a bit about how, what the treatment process for neonatal jaundice is like at Evercare Hospital, and how can they, get in touch with Evercare Hospital?
Okay, thank you so much, Judy. Thank you. So at Evercare Hospital, we have our inborn and outborn newborn cares. So for our inborn care, so once the mother delivers a child, within 6 hours, if that child has a high risk of having jaundice, it means we are anticipating. We have found a child likely he has infection. They have a possible ABO incompatibility. He has an inherited disorder of G6PD deficiency. What we mean is that child is going to be on our closed loop. So what we do from 12 hours of age, we start checking jaundice with what we call transcutaneous bilidometer. It's not every facility that has. It's just a instrument that it looks like a beautiful camera. You just snap the light on the child's body without any invasive thing, and it tells you the value of the jaundice that the child has. So once we get there, and if it's high, we now take tiny blood from the child, and check the level. If it's a level that requires treatment, we start phototherapy. We have LED phototherapy that we use, and trust me, within 24 hours, 48 hours, your child is out of that place. Now for our outborn, when they come in, we also have a place we keep for them, still inside our neonatal intensive care. We keep them by the side. So once they come in, we also try to find out the cause, depending on the age of that child. We've tried to do lots of investigation to find out what is the cause of this jaundice. Once the cause is found, that child, if he requires treatment, the same treatment protocol. So we have our standard operating procedure. We'll have our policies and procedures in place. Once a child comes in and he requires treatment, is either you're going to require a phototherapy, or you're going to require exchange blood transfusion, or we are going to monitor you closely. So you come in, we give you appointments, and we check. Now, I must emphasize, jaundice normally starts from normal jaundice from the second day of life. It starts increasing up until third day, and it peaks and gets to the level at the 5th day of life before it starts coming down, which is the reason once a child is born, even when we discharge after 48 hours, we tell the mothers to come back in 2 days' time, because that is when we anticipate and know that the peak of the jaundice have reached. So if they come in and the peak is there and it requires treatment, we keep you. If it's fine, we, depending on the level, we will ask you to go, then come back again before we discharge you from the jaundice clinic. Thank you very much.
Very wonderful questions here. Is quite in-depth, I would say. Very, very in-depth. But very quickly, we do have to let you go. But make sure to reach out to Evercare Hospital. Their website is www.evercare.ng. Their telephone number is 0813-985-0710. That's 0813-985-0710. Their location is number 1 Admiralty Way, Bisola Durosimi Eti Drive, Lekki Peninsula Scheme 1. That's Lekki, Lagos. You can email them on info info@evercare.com.ng. I beg your pardon. That's info@evercare.ng. Check out the website is www.evercare.ng. Thank you so much, Doctor. I appreciate you for taking our. We went off script, but as always, you outdid yourself. Well done.
Thank you.
Clearly,
so much,
she's informed in this thing. Thank you, and thank you to everyone who called us in today. From Joy to Bolaji, Samuel, Amuchi to Tommy, and of course Ugochi, all the way from Ikeja that called in. And to Joy, Bolaji, and Samuel, you guys have won yourself 10,000 naira worth of voucher courtesy Evercare Hospital to use your very first consultancy fee right at Evercare Hospital. So send me a WhatsApp message to 0809 444 0981. Again, 0809 444 0981. Doctor, thank you so much.
Thank you very much.
All right, we're going back on the other side. It's more music on the Smooth Drive. My name is Judith TV. Thanks for listening.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria. Smooth Health on the Drive.
It's a global observation that helps raise people's awareness of
health information and tips for optimal well-being.
how to prevent it, detect or treat
Every
it.
Thursday at 5:15 p.m.
So Lagos, if you didn't know, now you know.